Today we will discuss on the topic Caries activity test. Caries activity test refers to a laboratory test for measuring caries activity. It is a test done for patient motivation and caries prevention programs. Caries activity test measures the probability of caries lesions in an individual. Usually, Lactobacillus and Streptococci are tested in various caries activity tests. Now we will look which are the major caries activity tests. So they are Lactobacillus colony test, calorimetric Snyder test, swab test, salivary Streptococcus mutans level test, Streptococcus mutans dip slide method, buffer capacity test, salivary reductase test, and finally enamel solubility test. So first we will look at Lactobacillus colony test. It is one of the oldest and the most widely used microbiological method for assessing the caries activity using Lactobacillus colony count. This method uses tomato peptone agar plates, which is a selective medium with a pH of 5. After inoculation of the patient's saliva and incubation, the number of acidic bacteria in a patient's saliva is measured by counting the number of colonies formed. So, result and interpretation of Lactobacillus count in relation to caries activities as follows. So, if the number of Lactobacillus per ml of saliva is from 0 to 1000 colonies, the caries activity report is recorded as little or none. If the Lactobacillus count is from 1000 to 5000 colonies, the caries activity is recorded as slight. 5000 to 10,000 colonies of Lactobacillus found per ml of saliva gives the reading as moderate. If more than 10,000 colonies are formed, the caries activity is recorded as marked. Colorimetric Snyder test. So this is a colorimetric based caries activity test developed by Snyder in 1951. The test is based on the rate of acid produced when a sample of stimulated saliva is inoculated into a glucose and agar containing medium of pH between 4.7 and 5. A color indicator medium using bromocresol green is usually used. So bromocresol green changes from blue-green at pH of 4.7 to 5 to and yellow at pH 4, giving and estimating the presence of acidogenic microorganism in the sample saliva. Changes its color and compared to an uninoculated control tube after 24, 48 and 72 hours of incubation. So first we will look how the test is done. So saliva is observed at 24 hours. So after 24 hours the color changes to yellow. The caries activity result is given as marked and the test is completed. Whereas if the color is still green, the test is continued until 48 hours and after 48 hours again it is observed. So now if it is yellow in color, the caries activity test is completed and the result is given as definite caries activity. Whereas if the color is green, the test is again continued for 72 hours. After 72 hours, the color turns yellow. The result is given as limited caries activity. Whereas even after 72 hours, the color is still green. The result may be given as inactive. What are the advantages? Colorimetric Snyder test is a simple test to be done and it helps in assessing the oral environmental caries challenge. But there are disadvantages too. The test cannot predict the extent of expectancy of caries with any reliability for an individual. Moving on to swab test. The swab test is similar to Snyder test. The test is done by swabbing the buccal surface of the teeth with a cotton applicator and incubated in the medium. After 48-hour incubation, pH is recorded using a pH meter or the color change is read by using of a color comparator. A pH of 4.1 and below denotes marked Caries activity. 4.2 to 4.4 is considered active. 4.5 to 4.6 is considered slightly active. 4.6, which is very near to 5 and above, is considered as Caries inactive. Salivary Streptococcus mutans level test. This test involves obtaining samples using tongue blades or a wooden spatula and incubation of the sample on Mites salivary agar or MSA agar. It is a selective streptococcal medium with increased concentration of sugar at 20% and 0.2 unit of bacitracin per ml to suppress growth of the other non-streptococcus mucus colonies. So agar plates are incubated at 37 degrees Celsius for 48 hours with a 95% nitrogen and 5% carbon dioxide. The streptococcus mucus greater than 10 raised to 5 are indicator of an acceptable karyogenic challenge. Colonization does not occur until the level of streptococcus mucus reaches 4.5 into 10 raised to 4 per ml for smooth surface and 10.3 per ml of occlusal fissures in a clinical setting. High streptococcus mutants counts with Caries activity. Streptococcus dip slide method. Here saliva is collected for 5 minutes and is poured over the MSA agar coated slides and the excess saliva is allowed to drain off. After the slides are dry, bacitracin discs are placed in the middle of the inoculated agar, about 1 centimeter from each other. The slides is then incubated in a tube containing carbon dioxide tablet for 48 hours. A zone of inhibition 10 to 20 millimeters diameter is formed around each bacitracin disc. So if present, streptococcus mutants appear as small blue colonies growing within the zone of inhibition. Moving on to buffer capacity test. Buffer capacity test evaluates the quality of base required to bring color indicators to the endpoint. This test relates the buffer capacity of saliva and Caries activity. Patients with increased fondness to Caries have a lower buffering capacity in their saliva than saliva of those who are relatively free. Salivary reductase test. In salivary reductase test, color indicator used is diazoresorcinol, which changes from blue to red or colorless or whitish on reduction by the mixed salivary flora. So interpretation of the salivary reductase test is as follows. So if the color changes to blue in 15 minutes, score is given as 1 and the report is given as non-conductive. If it turns orchid in 15 minutes, score is 2 and report is given as slightly conducive. If the color changes to red in 15 minutes, score is given as 3 and moderately conducive. Whereas if red color is formed immediately, the scoring is 4 and the report given as highly conducive. If the result is pink or white immediately, the score is given as 5 and the report is given as extremely conducive. Moving on to the final test, that is the enamel solubility test. Here patient saliva is mixed with the glucose and 1 milligram of powdered enamel. Test measures powdered enamel dissolved in 4 hours by the acid formed. The disadvantages are the test is not simple, it is very expensive and impractical. So Caries activity test is a frequently asked question, either as a 5-mark question or a 3-mark question. Thank you.